Meantime, the World Health Organization holds an emergency meeting today to determine whether to declare a public health emergency regarding the coronavirus. Here's what we know so far. Chinese officials say the death toll has risen to 170, 7,900 cases worldwide, and the number of cases in China surpasses the total cases during the SARS epidemic of '03. Meantime, the president appoints and meets with the coronavirus task force yesterday, set to meet daily to discuss ongoing developments, both domestic and overseas. Joining us now is the head of that task force, U.S. Health and Human Services Secretary Alex Azar. Mr. Secretary, good morning. Good to have you with us.
Glad to be with you all. Thank you very much.
You said when you announced the task force that the risk of infection for Americans remains low. Will that assessment change if World Health does declare an emergency?
No. What the World Health Organization does in terms of declaring whether there's a public health emergency of international consequence won't change in any way. What we're doing here in the United States to prepare and respond to the novel coronavirus threat. As you mentioned, the threat to any individual American is really quite low at this time. But under President Trump's direction, we're proactively preparing in the event of further spread, and we're taking necessary steps to prevent and mitigate the potential for future spread.
We've seen a lot of selective flight restrictions from the airlines themselves. What would it take to mandate flight restrictions?
Well, we're not going to take any public health options off the table to protect the American public. But what we're seeing already is a diminution in flights going back and forth between China and the United States, just as a natural consequence of the State Department has put in place what's called a level 4 travel advisory for Hubei province, the epicenter, which means don't travel there. And then a level 3 for all of China, meaning to think very carefully before traveling there. So we've seen flights come down. We're seeing air traffic going down on a passenger basis. So this is naturally occurring as we speak.
Yeah, well, we can understand, Mr. Secretary, why Americans certainly would not be traveling to China. But my understanding is as many as 8,000 people from China can arrive here every day on flights. Given the nature of the virus as we understand it so far, where you're not necessarily presenting symptoms for as long as 7 to 10 days, why aren't we just stopping them from arriving here?
Well, we're going to take all necessary public health approaches that are appropriate. We've got at the major airports where Chinese flights come in and Chinese travelers come in, we're using our surveillance, our quarantine and inspection services surveillance systems to ensure that individuals coming in are looked at, and if they identify with any type of symptoms, as we always do for illness, they'll be pulled aside and we'll be able to explore that. In addition, this is most important for any type of infectious disease situation, we're educating people as they come in to be on the lookout for presenting any symptoms. It's important to remember that the 5 individuals that we have identified in the United States with this novel coronavirus came in not as a result of proactive screening of them, but rather because they self-identified as having symptoms and were taken into the public health system as a result.
And so you think that's enough? Because, again, these people can certainly leave the airport without having been identified, given they may not be showing symptoms. You think it's enough to rely on them to self-identify if, in fact, they do get sick?
What we do is a multi-layered approach. So we do border screenings and surveillance. But the most important part of what we do, why America has the best public health system in the world, is we do the basic blocking and tackling of public health, which is we've educated and alerted from the outset our healthcare providers to be on the alert for symptoms and risk factors. We isolate individuals who present potential symptoms, we diagnose them, we treat them, and then we do the contact tracing of the people that they've been in contact with, and if necessary, the contacts of those contacts. And that's what we have. We have teams deployed, state, local, and CDC on each of those 5 individuals and their contacts.
Do you feel like you have enough information on the virus at this point to understand what we need to understand about it?
Well, we have a lot of knowledge about it, but we've been very transparent that there's some key facts that we don't know about this very novel emerging virus. And that's why we're delighted that China has invited the CDC to participate in a World Health Organization team of experts that will go on the ground in China so that we can work with Chinese experts, look at the data, develop the tests that we want to do to ensure we get a better sense of how contagious is this virus, what is the severity of the virus, what do we see in terms of the incubation period on the virus. So all of those, the basic information that we've got to get a real epidemiological profile on this, and we're there to help the Chinese do that.
All right, Mr. Secretary Jim Cramer, I am confused about the notion of allowing flights from China, from this, from that city, whatever. I try to think, if I am live in the PRC, I know that my healthcare system's not nearly as good as the United States. I know that there's Shanghai has 3 hospitals. Each one handles 500,000 people. I know that I got a third-rate medical system with not great doctors. Don't I want to be able to play in the United States and get sick here?
So, Jim, we're actually not seeing that. In fact, the Chinese government has shut down travel out of the Hubei province, and so we don't have any direct flights coming from Wuhan to the United States anymore. We have occasional travelers who have routed from there through other cities, and we're actually identifying them with active surveillance. And then the other individuals coming from China, we're seeing a fairly radical diminution in travel even from China into the United States, as well as the downscaling of flights. But we're going to take any steps that are recommended by our teams as public health measures to protect the American people.
I have seen some comparisons to the Chinese ability to treat medical instances at scale, and how arguably that's much better than it was during SARS many years ago. Would you agree with that assessment?
Well, I was here for SARS. I've been here for anthrax. I was here for SARS, smallpox preparedness, monkeypox, pandemic flu, Ebola. So we've got a team that's got a heck of a lot of experience, both in leadership as well as the world's best career public health people. And what I have seen so far is a fairly radical departure in terms of the Chinese government's communication, transparency, and cooperation with us and the world community compared to SARS. Could it be better? Well, we'll see. But I'm really happy we're going to be part of this World Health Organization team. And that China has invited the CDC to be part of that on the ground in China.
Well, Mr. Secretary, what is the reason for taking the risk, slight as it may be, as you seem to explain, of letting in or continuing to allow people from China to travel here? Why would we?
So whenever you're dealing with a public health issue like this, notions of shutting one's border down, for instance, borders are very porous all around the world. So individuals can come from different places, and you can actually sometimes create hysteria simply by taking various measures. We have active advisories in place against travel to various parts of China, and in fact, Level 3 State Department warning suggesting Americans shouldn't travel to any part of China unless they take very serious precautions and think hard about why they should be traveling there. We're going to take any steps that are necessary, though, to protect the American public, but they need to make sense. They should be justified. But we're going to take any steps we needed. Nothing's off the table.
Mr. Secretary, would you go to Wuhan?
Would I go to Wuhan? Of course not, because we have a level 4 advisory saying Americans should not go to Hubei province. So I wouldn't go there unless I need
Wuhan,
to. For my,
I want to get to Beijing, and then I want to get on a plane to here. I mean,
and we're tracking we're tracking any individual who would come from Wuhan.
But you can't tell. I mean, that's the whole point of the thing. It's a 2-week gestation period, and so you can't tell. I see people trying to take temperatures of people, and I'm not laughing at that. Everything matters, but. I mean, isn't the whole thing that's really scary, Mr. Secretary, that you don't know you have it and nobody knows you have it, and you can't monitor all those people who come here? I'm trying to figure out why it's scary. I listen to you and I think, well, I have a flu shot. I'm doing well. Everybody else is doing well. It's what we have in this country is worse than what they have. And I don't know. Maybe we're all making too much of it, but I don't want a person from China next to me.
Well, Jim, it's important not to overreact and to use evidence. And so when individuals travel, they're going to travel in the United States from various ways. They could travel through France or through Germany. And so we need to take steps that are appropriate to protect the public health. Nothing is off the table. But we also just shouldn't take steps that are symbolic to make us feel good. We should do what's necessary, because at the end of the day, with any infectious disease, the profile of this is not uncommon. Diseases have incubation periods. People with respiratory illness shed the virus most commonly when they're symptomatic and when they're most symptomatic. The public health infrastructure, the basic blocking and tackling, educate, identify, isolate, diagnose, treat, contact trace. This is what solves public health outbreaks of infectious disease. It has in every instance in the past. It's what we did with the latest measles outbreak. It's what we're doing now.